I'm Dr. Alan Greene. I could not be more excited about the Conscious Kitchen. It's such a delicious, powerful way to make an investment in our kids. Today in the United States, it's estimated that there are 16 million lost IQ points among kids just from exposure to pesticides. Actually, in that study, it's just one pesticide, chlorpyrifos. And it's estimated that just by choosing mostly organic foods, we can eliminate that problem and find those IQ points. In the news, you hear about the obesity epidemic, and that's all too true. But it's much broader than that and deeper than that. What kids eat at school helps form the habits that they're going to have, not just as kids, but for the rest of their lives. What kids eat changes how likely they're going to do well in school and perform well on standardized tests. What kids eat changes how well they perform in sports. It changes their mood, their behavior, their attention. It changes how often kids get sick each year. What kids eat changes how long they'll stay sick when they do get sick. And it has a lasting effect. What kids eat as kids changes how likely they are to get hypertension as an adult or diabetes as an adult. What kids eat as kids changes how long they're likely to live. So how are we doing in the United States? The USDA did a survey in the 21st century looking at what kids actually eat in America. They listed the top 25 sources of calories in childhood. They found if kids in America came with an ingredient label, the number 3 ingredient would be soda. The number 2 ingredient, pizza. The number 1 ingredient, processed white flour treats. But here's the thing, of the top 25 foods, the only vegetable on the list was French fries. I know. And there was only one fruit on the list, apple juice. So, how big a deal is this? What kind of impact has this had on our kids? When I started as a pediatrician in Oakland, it was rare for a child to have high blood pressure. Didn't happen. That was something that happened in middle age. But spoiler alert, today, and my career's not been that long, today, millions of children have high blood pressure. When I started, it was rare for a kid to have insulin resistance and rising blood sugars. That was something that happened to the elderly. It was rare for kids to have high cholesterol or triglycerides. That was a middle-aged condition. It was rare for little girls to have a waist size of 36 inches or more, or boys to have 40 inches or more. But today, as we're here to celebrate this incredible food project, today in the United States, 2/3 of American children already have at least one of those middle-aged conditions by the time they hit middle school. Now, on the one hand, that is absolutely terrifying. It is a ticking time bomb. On the other hand, that's some of the most hopeful, encouraging news. Because if we start earlier, if we start in elementary school, we can reverse the most pressing health problems of our age. We have the opportunity at school to cultivate nutritional intelligence, which is the ability to recognize and enjoy healthy amounts of good food. And that's just what's happening here. So, bon appetit, and I can't imagine a better investment in the health of our kids.